We often think of mental health as, well, universal, right? Something that exists the same everywhere.
Hmm.
But what if the way we see it, the way we talk about it, even how we seek help for it,
Uh-huh.
what if that's all deeply shaped by culture?
That's exactly it.
So today, we're doing a deep dive into this really fascinating area, how culture isn't just, traditions or language. It profoundly influences something so personal, our mental health.
It really is an intricate dance.
Yeah.
And we've looked at a whole range of sources exploring this, especially from the perspective of, well, how do we provide support that actually works for people?
Right.
Our aim here is really to pull out those key insights, those nuggets of knowledge, so you can get a quick handle on how much cultural values and beliefs really do impact perceptions, expressions, and help seeking.
Yeah, our mission for this deep dive is basically to give you a shortcut, a way to get informed on this crucial topic,
Yeah.
equip you with insights into what offering truly inclusive, respectful support actually looks like in our diverse world. So, one of the biggest things jumping out from the sources is just how deeply culture isn't just a filter for mental health. It seems to actively sculpt our inner worlds.
It really does. It dictates not just what we see, but how we even frame the idea of mental well-being itself.
And that's not abstract, is it? It directly influences whether someone even looks for help, what kind of help, and the support they get or don't get.
Exactly. And what's often really striking is the pervasive nature of cultural stigma.
Mm-hmm.
In many cultures, maybe more than we realize, mental health issues are seen as a weakness, something to hide.
Right.
And that creates this huge barrier. It makes open conversation, asking for help, incredibly difficult, like a wall of silence around very real struggles.
Yeah, well, and it strikes me this goes even deeper than just like access to care. It seems to shape the actual language people use for suffering.
Yeah,
How does culture influence how people describe symptoms?
that's a critical point.
Yeah.
Take the Amish community, for example. Sources highlight they might endure significant physical, emotional pain quite stoically,
Yeah.
without much complaint.
Wow.
And in other contexts, people might express mood changes through, very real bodily symptoms, pain, fatigue, weakness, even if there isn't a direct medical cause. It's their culturally accepted way of showing distress.
And then you have things like attack de nervios that just pulls back the curtain on how specific this can be.
Right, the attack of the nerves.
Uh,
A really compelling example for some Hispanic populations.
yeah.
It presents with symptoms that can seem quite dramatic, uncontrollable, shouting, crying, trembling, feeling intense heat,
Hmm.
usually after something really distressing happens.
And it's understood within that context.
Exactly. It's not just seen as an emotional outburst. It's a culturally recognized way of expressing intense distress. And beyond how it's expressed, culture also heavily influences the support someone gets from family, from the community.
Hmm.
That stigma we mentioned can tragically isolate someone right when they need connection most.
So it's clear then, the gaps in access and understanding, they're huge. Which brings us to a really critical point for you listening. What does all this mean for you? Maybe you're supporting someone or even thinking about getting support yourself.
Absolutely. And if we connect this to the bigger picture, it helps explain why we see these disparities in help-seeking behaviors.
Yeah.
Our sources point out, for instance, that historically marginalized communities in the U.S. are often less likely to access mental health treatment, or they might wait until symptoms are really severe.
Right. Delaying care.
Exactly. And we also see different rates of substance use disorders across racial and ethnic groups. Now, neurobiology plays a part for sure, but the cultural context, stigma, access definitely influences those patterns too.
So given how deep these cultural patterns run, the huge question becomes, how do we bridge that gap? How do professionals, how does society offer care that's truly effective and compassionate?
That's the vital question, especially for anyone in a caring profession. The American Nurses Association, the ANA, for example, they really emphasize this ethical obligation.
Uh-huh.
Nurses need to practice with cultural humility and provide culturally responsive care. It's right there in their standard of respectful and equitable practice.
We hear cultural competence a lot, but the sources really focus on cultural humility. It feels like a subtle but really important shift.
It is.
It's not about knowing everything about every culture, which is impossible anyway, right?
Right.
It's more about having this lifelong stance of learning and maybe self-reflection. What makes that approach different?
Well, it fundamentally shifts the focus. It's not about knowing about cultures, but being genuinely open to learning from each individual you interact with.
Okay.
And alongside humility comes inclusive practice.
Mm.
Basically making sure no one gets left behind, whether it's
Yeah.
due to physical challenges,
Yeah.
mental health conditions, belonging to a minority group.
Mm.
It's about actively dismantling those systemic barriers to access and opportunity.
And this lines up with global standards too, doesn't it? The World Health Organization's Mental Health Intervention Guide. It talks about promoting respect and dignity in culturally appropriate ways.
Yes, exactly. Things like protecting confidentiality, ensuring privacy, giving clear information, explaining risks and benefits of treatment, and obviously getting informed consent.
So embedding respect into the whole process.
Precisely.
Okay, so we get the why.
Yeah.
It's hugely important. But now, the how. When you're actually sitting with someone trying to offer support, how do you navigate these really sensitive conversations?
Yeah, the how is key.
Effective communication seems like the absolute bedrock here for building trust,
It absolutely is. And it really starts with creating an open, safe environment.
like physically.
Yes, partly. Meeting in a private space, for
Yeah.
sure. But also conducting introductions in a way that feels culturally appropriate for that person. It sets the whole tone.
Right, and the non-judgmental approach.
Yes.
That's not just like a nice idea, it's crucial.
Essential. Being friendly, respectful, genuinely non-judgmental about behaviors, appearances, everything.
And active listening.
Yes. Active empathic listening, letting the person speak without interrupting, asking for clarification if you're unsure, really hearing them, not just waiting to talk.
Mm-hmm.
There's actually a concrete tool that can help with this, developed by the American Psychiatric Association. It's called the Cultural Formulation Interview, or CFI.
CFI. Okay.
Yeah, it's a set of evidence-based questions designed to weave that cultural assessment right into client care.
How does it work?
Well, it helps clarify the problem from the individual's perspective and also from their social network's view. It explores potential sources of help they might trust and, importantly, what they actually expect from services.
So it's really centering their view.
Exactly. That emphasis on the client's perception is critical. It creates more of a partnership.
Rather than just ticking symptom boxes.
Right. It moves beyond symptom spotting to understanding the lived experience.
Mm.
The CFI helps explore, aspects of their background communities, languages, race, gender, faith, things that might subtly but powerfully shape their experience of the problem or their comfort with seeking care.
Okay.
And yes, it really emphasizes asking clients about their perceptions. What do they think is wrong? How would they treat their symptoms? It empowers them to lead that conversation about cultural impacts.
Letting them lead. I like that. So, okay, we've listened, we've hopefully understood better.
Sure.
Then what? How do we act on that understanding, turn it into care that actually fits the individual?
That's the next crucial step. Individualizing care based on these cultural factors.
Mm.
That is patient-centered care, really.
Mm-hmm.
The insights you get from assessments like the CFI should directly shape the care plan, tailor it to their specific preferences, values, beliefs, goals.
Yeah.
It's moving away from any kind of one-size-fits-all thinking.
Which means using the right communication tools, too, presumably.
Absolutely. Making sure your skills, the materials you use, everything is suitable for the person's culture, their literacy level, their language.
Right.
Which includes the absolute necessity of using qualified healthcare interpreters and translators when needed. You have to ensure messages are accurately conveyed, truly understood both ways.
Can't skimp on that.
No way. And it also means constantly remembering the cultural context of how symptoms show up.
Like the physical symptoms versus emotional expression we talked about?
Exactly. Knowing how anxiety might manifest differently across cultures, maybe physically rather than emotionally, is essential for effective treatment. Without that lens, you could easily miss vital cues.
Makes sense. And then making the right referrals, too, if more assessment is needed.
Yes. Appropriate referrals are key, especially when you see signs of undiagnosed or poorly managed conditions. But always doing that with an understanding of the role culture is playing in that person's mental health journey, making sure they get the right support at the right time.
Okay, so this whole journey, it seems, brings us back to ourselves in the end.
It does.
What's our role? As individuals, as professionals, as a society, how do we keep getting better at this really vital work?
It really has to start with self-awareness.
Uh-huh.
Recognizing how our own cultural background, our values, our beliefs,
Mm.
how they subtly influence our responses to others, whether they're clients or coworkers.
Looking in the mirror, basically.
Pretty much, yeah.
Mm.
It requires ongoing, active reflection on our personal biases, our heritage, our assumptions.
We have to be honest, that stigma, those negative attitudes towards mental illness, they can exist even among professionals, right?
Unfortunately, yes.
Yeah.
Professionals aren't immune. They might share some stereotypical beliefs without even realizing it.
So the first step to tackling stigma externally is maybe tackling it internally, becoming aware of our own beliefs.
That's a huge part of it. It's an ongoing reflective process. And that naturally leads to the need for continuous learning. Our sources really stress that professionals are expected to keep improving their communication skills, engage in lifelong learning, really try to understand the cultural preferences, the worldviews, the choices of diverse people.
It's not a course you take once and you're done.
Not at all. It's an evolving journey of understanding. And the literature fully supports this. Nursing literature, for example, strongly advocates for more mental health education for both new and experienced nurses.
Why? To boost knowledge.
To boost knowledge, yes, but also to actively reduce stigma within the profession itself. It's about refining ethical competence through ongoing education and that dedicated self-development, building a better, more empathetic foundation for everyone.
Wow, okay. So this deep dive has really hammered home that profound connection between culture and mental well-being.
Undeniable, yeah.
It just underscores how critical it is to approach things with cultural humility, inclusivity, and, yeah, that deep self-awareness in all our interactions.
Mhm.
Seeing the whole person shaped by their unique world and meeting them where they actually are.
And it's worth reinforcing, understanding these nuances isn't just for clinical settings or professional duties.
Right.
It's about fostering more empathetic, more effective human connections everywhere, at home, at work, in our communities. It makes us better communicators, better neighbors, better people.
So as you reflect on all this, maybe consider this. In what subtle ways might your own cultural background be shaping how you perceive mental health, either for yourself or for the people around you? And how might just that awareness open new doors to understanding and maybe to support? Thank you so much for joining us on this deep dive. Until next time, keep connecting and keep growing.